What's up, everybody? I'm Cassandra Hein, coming to you for Healthcare TV Network with our favorite doctor, Dr. Raj. I'm glad that you could join us today. Now, you know, there's a lot of controversy right now around a study that came out of France regarding hydroxychloroquine. You know what is hydroxychloroquine? What is the study? Give us the controversy. What's happening?
Well, you know, Cassandra, many medical students, residents, and my colleagues have been asking about this study. So I had to go back, spent some time in my room, locked the door, and had to review that study. And the reason why I'm so passionate about it is that we are changing the whole way our health network is functioning based upon, as you would, well, I'm going to tell you, a very, very small study. So this study, I have it right here, I printed it out for us. It's called Hydroxychloroquine and azithromycin as treatment for COVID-19. So for those of you who haven't read the study or heard of the study, I summarized it for you in my notes over here. So the study was actually 36 patients. Stop right there. 36 patients, and we're changing the entire way the world thinks on 36 patients. I just leave it at that. Okay, so some of them, all of them were SARS-CoV-2 positive. So that's going to be, when we talk about COVID-19, they were positive for the disease. When we talk about how were the patients, some were asymptomatic. And that's a lot of what we're talking about now, are the asymptomatic people that may be infecting others. Some had upper respiratory tract symptoms, the runny nose, the tickle behind the throat. We've all had that. And of course, some had lower respiratory tract problems. That's what I always worry about in the ICU, getting things such as a pneumonia. So they put the study of these 36 patients into two broad groups. One group was given hydroxychloroquine. The brand name for that many people call it is called Plaquenil. And there were 20 people in that group. In the other group, there were 16 people, and they got what's called standard of care. And basically, as you know, for most viruses, what do? Nothing. We just actually support them. We support their blood pressure with IV fluids. We support their oxygenation by maybe giving oxygen. So they just got what's called supportive management. So if you're in the hydroxychloroquine group, they were giving 200 milligrams of hydroxychloroquine every 8 hours. And the primary outcome of the study was there viral eradication at 6 days. So not only was there only 36 patients, this was a short study. The secondary outcomes of the study was to see the time to eradication. Could they get there quicker by being on hydroxychloroquine? And how do they know that? They were actually doing daily swabs to see if the virus was eradicated. So let's jump to day 6. So at day 6, they saw that 70% of patients who got hydroxychloroquine had a negative, what we call PCR, and this is a way to detect the virus in the swabs. And this was versus the 12% who eradicated who didn't get therapy. So because of this, 70% of these patients, which was the 20 patients on the hydroxychloroquine, they're, wow, this is an amazing drug. But it gets a little more interesting. Let me turn my page. So of those 20 patients, I did my homework for everyone. Healthcare TV Network, you got your money's worth today. So of the 20 patients, 6 of those patients received azithromycin. I think many of you guys call this a Z-Pack, you know? And they received the azithromycin because in the study, they probably had a suspected bacterial infection, or they're given azithromycin just prophylactically. Anyways, so of the 20 patients, 6 patients got azithromycin combined with hydroxychloroquine. So what happened was all 6 who got both cleared their virus from their nasopharyngeal sample. And it's because it was 100% of those 6 people that got both that let's make a title of a study, and everyone is buying hydroxychloroquine and azithromycin. So a couple things that jump out at me as a clinician. I'm going to tell everyone out there, I'm not a biostatistician. I'm not an epidemiologist. I'm just reading the study as most clinicians should if they got the time. So what concerned me was, number one, there were no clinical outcomes. I mean, you're checking on their way of checking if the swab was negative for the virus. Sure. Does that mean less people get intubated on the ventilator? Does that mean more people get discharged from the hospital quicker? Does that mean they symptomatically feel better? I mean, there's so many different things beyond just checking if your swab is positive or negative. So no clinical outcomes, I would say, is one of the major points for me. Now, from a study standpoint, and once again, I'm not a biostatistician, there was no control group for comparing the azithromycin and hydroxychloroquine together. Sure, 6 people got both, but there wasn't a group that got nothing comparing to that. So there was no control group. So when I think of the study, I wrote a little bottom line right here that, this study tells me we're just talking and looking at viral eradication. And yes, we're checking at different time points, but we don't know if that translates to a clinical, meaningful measurement for my patients. So I think the answer is, I'm so excited. This is a pandemic. I only want the best for everyone. And I'll be foolish to say I'm not wishing the best, that this is groundbreaking and helping everyone, but there is a methodology when it comes to approving FDA drugs. There's a reason why we're taught to, encompass and embrace evidence-based medicine. And I don't want to skip any steps to get to that endpoint.
What are the side effects of this drug?
So there are 2 drugs that, that we're talking about in this study. So let's talk about hydroxychloroquine. Many people call it by its brand name, Plaquenil. And I'll be honest with you, this drug has been around for quite some time. And how do I know so much about it is, number 1, my wife's a rheumatologist, so I hear about it all the time. And 2, the diseases I'm very passionate about are sarcoidosis and other rheumatological diseases, which this medication has been used very, very commonly for many, many years. So that's why I feel very confident talking about this. So hydroxychloroquine is well tolerated in most patients, bar none, which makes me excited because when you want to use a drug, you want to have a long track record of safety. When we talk about things that we worry about, the number 1 thing is the eye. So many of my clinicians out there have memorized for their board exams, there's a retinopathy that can be induced by this. In most cases, it usually takes years before you develop the retinopathy and having to be on the higher doses, which is one thing that I'm kind of worried about because usually we give around 400 milligrams of hydroxychloroquine. This is a weight-based drug, and most of my data for hydroxychloroquine are based upon my lupus patients that my wife manages or my sarcoid patients. So in the study, they were giving like 600 milligrams. It was 200 milligrams every 8 hours. So that's a big dose, So the eyes, which I don't think is going to be worrisome because we're using the drug for a short period of time. But let me just tell you this. Are we going to before I prescribe hydroxychloroquine to my sarcoid patients, I tell them to go see an optometrist or ophthalmologist to get a baseline eye exam. That doesn't sound reasonable when we're talking about a pandemic. I don't think we need to do that, but I just wanted to mention it. Another thing that many med students are going to jump up at is there's something called anemia, specifically G6PD deficiency people get anemia. What does that mean? If you're predisposed and you have this G6PD deficiency and you give this drug, you can get hemolysis. Once again, very, very uncommon. Do some doctors may check a G6PD level prior to initiating a drug? Yes. Does that make a lot of sense for a pandemic? No, but there are side effects. And the big one right now is the heart, meaning that hydroxychloroquine is one of the drugs that will change your EKG, meaning that it prolongates something called the QT interval. This is an EKG finding. And if your QT interval is prolongated, you can get arrhythmias like ventricular tachycardia, and that can result in death. Azithromycin, which is an antibiotic, and I think everyone takes a Z-Pack, you get a little tickle in your throat, give me the Z-Pack, So what is the downside is that, resistance. If we all start taking azithromycin for no reason, you're going to develop a lot of resistance. But another side effect that is coupled with the hydroxychloroquine is that QT interval being prolonged. Both drugs can do it. And if you're giving both drugs, you can get sudden cardiac death from these arrhythmias. So once again, you got to make sure people with known heart disease should not take this drug in theory or this combination, but it's a pandemic. I don't know what's going to happen. So they're not benign.
So there is a difference between hydroxychloroquine and chloroquine. and some guy in Arizona died of taking chloroquine. What happened there? Do you know about this?
Yeah, this is hot off the press. This just came out like a day ago where there was a news conference, and hey, I'm thinking about society, and if I am worried about coronavirus and people are saying just, hey, we have a cure, and like I'm oversimplifying it, people are going to gravitate towards it. And people are going to take the medication before studies are out there, before knowing about the cardiac side effects, before knowing about drug-drug interactions, because there are people who are already in panic mode, not just in being prepared. And it's unfortunate what happened. I don't have the details around the story, but I can imagine that if this is an elderly gentleman or female who passed away, who had pre-existing heart conditions, who knows? Maybe that's what happened. So I think this reminds us that there is a methodology before something gets FDA approved. And this is one example, if you jump the gun based upon media without the evidence of a really horrible outcome.
Is there anything else that we should know at this time?
If you're wondering why a pulmonary doctor like myself is so passionate about rheum diseases, it's because many rheum diseases affects the lungs. Lupus, rheumatoid arthritis, scleroderma, dermatomyositis. So I see many of these patients based upon the pulmonary problems they get. And we know right now, people who have predisposing pulmonary disease are the ones that are at the very high risk of death when we talk about COVID-19. So many questions I've been getting from my sarcoid patients. So for those who don't know, sarcoidosis is, I want to say a rare disease, but it's not rare when you have something, is it? And it affects every single part of the body, especially the lungs. You get inflammatory granulomas, basically. I don't want to go into a whole medical lecture about it, but rheum diseases, including sarcoid, use medications that suppress your immune system. So many people have been asking me, what do I do with my medications? And I wish I had a great answer for you, but the thing is that there are so many of these medications that suppress your immune system, and it's always about risk and benefit. So if I were to hold the medication that you've been using to control your rheumatoid arthritis, your lupus, your sarcoid, could you get a flare of your disease? And the answer is yes, you can. Now, one thing I would say is that when many diseases flare, specifically talking about sarcoid patients and maybe even rheumatoid and lupus, we tend to give steroids. And steroids have benefit, but many side effects, including suppressing your immune system. So the answer is you have to be a judge of your own symptoms, and you have to communicate with your doctors to see what the best is. It's not surprising that there is no cookie cutter sheet or flow chart on how to treat sarcoid, lupus, or rheumatoid arthritis, but you need to discuss these. One thing I've been doing with my patients with sarcoid, if I could prevent starting new medications at this time, I would like to do that. This is not the time to, if there's a judgment call where it can go either way, to err on giving an immunosuppressant, I'm not going to do that. I'm going to watch my patients more closely. But it's tough for everyone, and especially with hydroxychloroquine, I wanted to say that this is a patient I have my sarcoid patients on. I know my wife has patients with lupus on it. There actually was data that it improves mortality and survival when you're on hydroxychloroquine. And this is one of the core drugs that for a long time people with rheumatoid arthritis has been on. And now there's probably going to be a shortage. You know why? Because when you mention it on the news, people are going to buy out. And that's what I worry about the most, is that the people where there is the data that it does reduce mortality, it does improve survival, they're not going to have the drug anymore. And not to mention, these drugs also are anti-malarials, speaking specifically of hydroxychloroquine and chloroquine. And I want to make sure people who have malaria, I know that in the United States, we're very blessed not to have many cases of it, but it's out there. But this could be a shortage worldwide for these patients. So there are consequences when we gravitate towards something right away. We don't see it, but there are other people that need drugs that may not get it.
So is it safe to say that hydroxychloroquine is the new toilet paper?
It's going to be right next to it. And before I came on here, my wife and I were just looking at different, articles and websites, and I think there was actually already a shortage of hydroxychloroquine that you can't get it.
Really? Wow.
Yeah.
That's
so just to mention that.
Yeah, something to take note of. If you're not sick, don't buy it. Right? I mean.
And wait till more studies come out. You know what I mean? Let's go back to our opening sentence. I mean, it's right here. How many patients did they do in this trial? This was a trial of 36 patients, only 6 of which got the combination of azithromycin and hydroxychloroquine.
Well, thank you so much for your input. And we're going to try to keep everybody up to date on what's going on with COVID-19. Thank you so much, Dr. Raj.